Hello there, and welcome to People, Politics, and Power. I am Immunization. The global community is this week marking 50 years, that is half a century, of the expanded program on immunization, a collective effort to save and improve lives from vaccine-preventable diseases. Health experts say immunization programs have been instrumental in eradicating or curtailing diseases such as smallpox and polio, and enhancing the survival of millions of children. It is said that the global vaccine drive of the second half of the 20th century is one of humanity's greatest achievements. This is because in just 5 decades, humanity went from a situation where the death of a child was feared by many parents to a world where every child has a chance to live, survive, and thrive if vaccinated. The expanded program on immunization was started in 1974 and was focused on protecting all children against 6 childhood diseases. But today, the number has grown to 13 universally recommended vaccines across the life course and 17 additional vaccines with context-dependent recommendations. With the expansion, it is now called the Essential Program on Immunization. While 4 out of 5 children have been fully vaccinated globally in the last couple of years, with more than 4 million more children vaccinated in 2022 alone, there are, however, still about 20 million children who missed out on one or more of their vaccines. This has been attributed to growing conflicts, economic downturns, and a rise in vaccine hesitancy. Consequently, there have been sudden outbreaks of diphtheria and measles diseases in different parts of the world. This therefore appears to suggest that there is a need to do more for children to benefit from the life-saving power of vaccines, especially in the global south. Now, back home in Nigeria, what does the landscape of immunization look like? Are the country's children fully and adequately covered? If not, what are the prospects and challenges? This is the focus of our discussion on the program today. And when we return from this break, we'll be joined by 2 health specialists who will be telling us more about the immunization process in Nigeria and globally, what is being done to prevent children from being victims of preventable diseases. Stay with us.
Nigeria of our dream. The Nigeria we need is the united, indissoluble, and cohesive Nigeria, which guarantees equity, fairness, justice, and prosperity for its citizens. That is our focus on people, politics, and power. It is fresh, insightful, impactful. It's a must-watch. People, politics, and power on AIT.
All right, thank you so much for staying with us. Let's get to meet our guest now. Dr. Avua Joseph Oteri is the current advisor on immunization to the Nigerian Governors Forum and was before that a director at the National Primary Healthcare Development Agency. He is a public health consultant. Thank you so much for joining us, Dr. Oteri.
Thank you so much.
We're also joined by Dr. Obiora Ezebilo. He is a health specialist at UNICEF, that is the United Nations International Children's Emergency Fund. Dr. Ezebilo, thank you so much for joining us.
Thank you.
Welcome.
Welcome.
So let's, Ezebilo, let's begin this way. What is the World or Global Immunization Week all about? Why is it necessary to declare a whole week for, is it celebrating or marking immunization?
Okay, so actually you can call celebration or you can call marking, but the essence is to create awareness among the population on the needs and the necessities, what the population will derive from immunization. what everybody will derive, the good benefits of bringing your child to come to the health centers or attend any of the outreach sites to receive whatever vaccine that is due to them. So it's just a week that we dedicate. We promote immunization as much as we can and get experts to talk about immunization and just get people to know more about immunization. That, as we always say, that immunization is one of the most cost-effective public health intervention. So it's just a period of creating awareness, and we hope that after this week, going forward, we are going to reap the benefits of all the processes and the activities and all the talks and all the awareness that we have raised concerning immunization.
It's now called the expanded program on immunization. Why is that so?
So because we've included a lot of things, and when we talk about immunization, we also try to deliver immunization with other childhood interventions. So we deliver immunization, we know routine immunization, but a child comes to the clinic to receive measles, but you also have to check the weight, you have to check the nutrition status, you have to check if the child has malaria or if the child is sick of any other thing. So we are now seeing that integrating immunization with other things will help us to reap benefits faster and to make us to reach more children to prevent outbreaks of vaccine preventable diseases.
So, well, Dr. Terry, let me bring you in here. Which are the most prevalent of these vaccine preventable diseases that immunization tends or tries to tackle in Nigeria?
Okay, thank you so much. Like rightly mentioned, this year marked the 50th anniversary of EPI, which is now essential program immunization. And when it started, it was just 6 diseases: diphtheria, whooping cough, measles, polio, and maybe 1 or 2 of them, right? But as the years progress, they keep expanding. So as we speak, a lot of antigens have been added, which are life-saving, and also it is no longer immunization for just children alone. It's now a life course event. So it is expanded and it's essential. So virtually all the diseases that I listed earlier, measles. Measles is one disease that killed a lot of children, right? And give them a lot of complications, even meningitis. But these are all diseases that are now having vaccines that can actually handle them. So it's a good thing that a whole week is dedicated to immunization, just to show the effort that people are putting together to ensure that immunization is promoted, vaccines are promoted, and people are also told to go to the nearest health facilities to take the vaccine that his child or that particular person is due.
Is that to say, I mean, the immunization process started way back in 1974, 50 years ago. Is that to say that over time, there are more vaccines have now been developed to treat some of these diseases? Because, I mean, it started with just 6.
6 killer diseases, right.
And now we are talking of an expanded immunization program.
Yeah, actually, the history of vaccine didn't start 50 years ago. I'm sure you've heard of Edward Jenner. I'm sure most of us who are at this age will remember in those days they used to bring vaccine which they put as a gun in our hand. That was way before 1974, right? So it's a gradual process that has been on for over many years. So when you talk of smallpox, Jenner, you go back, in short, immunizations dated back at 15th century. And how did it come? It came with the mind that if somebody has an infection and the person is exposed to something close to that infection, the person develops immunity against that infection if the infection comes. So that's the bottom line of immunization. So it's been a very gradual process. And when we started, it was 6 killer diseases we're addressing. But now we have vaccines for just not that 6 again, a lot. Meningitis, polio, measles, rubella. They've added all wide range of diseases which immunization prevents. So they call them vaccine preventable diseases, and it's also related to which part of the world. If it's in Japan, you have diseases that are not here. They have vaccines for those diseases. So in Nigeria here, meningitis is here. We don't have meningitis in other parts of the world, apart from the meningitic belt of Africa and the South America. So those ones addresses diseases specific to that area. That's the whole myriad of how the EPI works. It addresses what the particular region needs at a particular time.
Dr. Ezebilo, many people will think, oh, this is purely health matter and should actually be dealt with by the World Health Organization. Oh, where does the UNICEF come in here? How does it come in here?
Okay, first of all, let me make it clear. Dealt with World Health Organization, but you should know that we say partners. So WHO provides technical support just like other people, including UNICEF. Know that WHO, there's no way WHO can improve immunization alone. You have to work with the government of the country. So that's where UNICEF comes in. UNICEF also comes in MPACDA, which is the main body that is charged with the responsibility of delivering vaccines to our children, works in collaboration with WHO and other partners, which includes UNICEF. Okay, UNICEF is known so much. We have so much interest in women and children. We have areas of comparative advantage, which it comes to vaccine management and logistics and communication, or what we call social behavioral change. So UNICEF tries to tap on that expertise to make sure that we support the country in bringing in vaccines, potent vaccines into the country. We also support the country in putting up either funding or providing technical support to build social mobilization activities that make our caregivers present their children for immunization. So apart from that, UNICEF also provides a lot of technical support in the planning and implementation of all the immunization activities, which is aimed at preventing vaccine outbreaks from vaccine preventable diseases. UNICEF is well known in the country. We participate in every level. At the national level, we have the ICC. UNICEF is a member. At the country level, all the coordination committees at the national level, at the state level, and the LG level, UNICEF all participates just to provide that technical support. The aim is just to make sure that these potent vaccines that have been brought into the country, we make sure that our children receive these vaccines, because we believe that when our children receive these vaccines, the incidences of outbreaks again for vaccine-preventable diseases will be reduced. If these outbreaks are reduced, our children will live long. So that is the role that UNICEF comes in.
Let me expand that a bit to the global level. In terms, because the aim is to, say, achieve universal immunization coverage. So how is UNICEF trying to achieve that? How much of that has happened in the last 50 years? We're looking at 5 decades now that this has been actively been on ground. So how much of that has happened universally?
No, that has not really happened, because we have set targets. We have global targets for each vaccine. What I mean that we have what we call coverages. We have the number of children that should receive a particular vaccine for it to build, for the community to have herd immunity against the vaccine. That has not happened. And UNICEF is supporting everything, as I said. Part of it happening is for us to have potent vaccines. UNICEF is supporting that and bringing in potent vaccines for our children to be protected. Part of it is having a good community engagement for our caregivers to know that these vaccines are potent and safe. That is also what UNICEF is doing. When you look at the Nigeria context, as I said, there are certain coverages as we expect vaccines to reach before we are able to prevent vaccine outbreaks of vaccine-preventable diseases. In Nigeria, if you look at what the landscape is, like our Penta 3 coverage in the last NICS 2021, I think it was 57. In as much as we have progressed from 2016 to 2021, from 33 to 57, that is progress, but we are yet to attain that 80-85% coverage, which we expect to have for Penta 3. If you look at our measles for 2016, we had about 40%. We have progressed to up to 60% in the mixed NICS of 2021, but that is not yet enough to build herd immunity to prevent measles outbreak. In as much as, if you look at our, I think, fully immunized child, if you look at the 2016 NICS mix, we had about 23. We have progressed to 44. That means that 44% of our children that are less than 2 years are able to receive the appropriate vaccines as at when due. But that is not yet enough to prevent vaccine preventable outbreak.
Tell me more about this as and when due.
Okay. So in routine immunization, we have our routine immunization schedule. We have vaccines that every child that is less than 2 years should receive at birth. at birth. I don't want to bore you by listing them. We have vaccines that they should receive at birth. We have vaccines they should receive at 6 weeks, at 10 weeks, at 14 weeks. And we have the ones they should receive at 9 months and even 15 years. And MPSA, in collaboration with partners, have also even expanded it to, we have HPV now, where our children, girls, adolescent girls, even receive HPV. So it has even been expanded.
What is HPV?
Okay, human papilloma virus.
Good.
So the routine immunization landscape has really increased. Started from under 1, moved to under 2, and even now above 2 to capture adolescent children. So the point is that the country, MPSCDA with the new leadership, in support with collaboration with other partners, which includes WHO, UNICEF, Gavi, and many others, they are trying as much as possible to make sure that these potent vaccines that UNICEF supported the country in bringing in gets into the arms and legs of our children to prevent outbreaks of vaccine-preventable diseases.
We'll come back to whether or not this has really been successful, as successful as it was planned. But let me turn to Dr. Oteri. You advise the Nigerian Governors Forum on immunization, and so this is a familiar topic for you. What is the immunization landscape like in Nigeria today?
Okay, like you mentioned, it has actually expanded, and unlike before when it was more like partner-driven, because when you say universal coverage, I think Nigeria could say they achieved that in the 90s, 80s and 90s, but that was donor-driven. And when the donors left, and that was when we also had, I think, military regime, so a lot of issues happened to the left, and the coverages keep crashing and crashing till they got to the level that they have to form NPI. So in terms of landscape, yes, we've expanded the reach. More children are now being reached, and more people are putting more support. The immunization there are donors supporting immunization, BMGF, Gavi, and the rest are supporting. You said most of the country they support immunization. We also have partners that are helping to provide technical support, like ASABILO, UNICEF, WHO, and the rest. So you cannot provide those things without having the government involved. So the government involvement is what is really, really key. Let me give an example. For instance, prior to my going to work at the Governors Forum, I didn't know that the information that is available to the governors, they don't get it. So we look at what is there and let the governors know. Prior to this, they didn't have some of those information. And you'll be surprised to hear that commissioners have difficulty even talking to their governors.
The commissioners for health?
From commissioners of various, they have difficulty talking to their governors. So the secretary is like a bridge. We get information that the government needs, from the national primary, from the ministry, department, and agencies, and synthesize it, put in a way that the governor can understand it. So they hold their meeting every month. So it is at that meeting that we place those information to them and say, look, your state needs to do A, B, C, D for your children to be protected. And most of the things, like campaigns, like you mentioned, campaign is not very cheap because these are things they do to actually shore up the coverage. Because when you say routine coverage, the ones you mentioned are all routine coverages. And when you talk of 50%, 67%, they cannot give you what you call herd immunity. Because you need the coverage to be very high for children that didn't even get the vaccine to get protected. That's what they call herd immunity. So for those campaigns they do, the government has to pay counterpart fund. They have to contribute to it in one way or the other. So most times, getting the information to governors is a challenge. So we at the Secretariat bridge this gap of information from National Primary Care Agency or whoever to the governors. So if a state is doing, like now, states do measles campaign, meningitis campaign, and the rest of them. There's a component of that funding that's supposed to come from the states. If the states don't bring that, the quality will drop, and the ownership of that campaign is actually no longer the ownership at the back and call of the state. So we tell the governors that, look, you need to bring A, B, C, D for this to happen. And we make it easier by telling them, look, this is the amount federal government and partners are bringing. We calculate the nearest kobo per child. So if a campaign is happening and total cost of vaccinating that child is about 300 naira, and the state is asked to bring 5 kobo or 50 kobo. Once the governor hears that this is the amount I'm contributing, most times they don't even waste time. They just bring that money, and that is so. Political commitment, ownership is what we drive at that Nigerian Governors Forum Secretariat, and we assist the MDs to actually pass information that they need for the work to go on well.
So from the statistics that may possibly be available to you now, what is the geographic footprint of immunization across the country today? Are there states that are doing better than others in terms of the immunization, particularly for children?
Yeah. Immunization, if you look at the coverage of immunization worldwide, you discover that some regions of the world are not doing as well as some other regions. So it also translates to country. So like in Nigeria now, you have the north, you have the south, you have the northwest, northeast, north central, and the rest. Because the southern states are more, I think, well, let's say, I don't want to use the word, they're more knowledgeable, right? But they have less problem of polio. Polio is one of the vaccine-preventable diseases which has been ravaging the northern states. I'm sure you all know the story of polio and how it went up because of refusal, rumors, which I'm sure we'll discuss again. So they've been battling with polio campaigns. So that reduces their ability to actually do the normal routine immunization. So the coverages in the north is relatively lower than that in the south. But of recent, because the northern states, they are getting good support as well to ensure that these coverages go up. So people like Gavi is supporting, I think 8 states signed MOU with 8 states. That is what I do there. And the 8 states, KB and from northern state, the only southern state is Bayelsa. And those support have actually gingered these states to actually have good coverage. KB, if you look at KB coverage some years back and look at the coverage now, you will be really marvel that, yes, a lot of support has really gone in and is yielding dividends. So the northern states coverage is not as good as the southern state. But when you do campaign, that's when you do supplemental immunization activities where you go in for a week or a month, a week or a few days, reach the children that have not been reached. The north tend to do better than the south because they've been doing a lot of polio campaigns. So they understand campaign more than the routine. So that's the diversity of how the country is. But I think in essence, the gap between the north and the south is actually bridging as we progress.
So flowing from that, what would you consider to be the major challenges of the immunization campaign in Nigeria?
Okay, challenges range from both demand and supply section. So you have to demand it. So that is what those rumors actually affect. So like I mentioned about polio, the rumors about polio vaccine caused a lot of pitfall for the program, more in the northern states. So that is a major challenge. But with what Isabella mentioned, they are the one handling those behavioral changes, which they've actually done over the years to actually make people accept immunization. We have the Northern Regional Leaders Committee, led by the Sultan of Sokoto. It's a presidential committee which has actually helped in telling the emirs, the traditional platform, that look, these are the things that need to be done, and they are doing it. You have the religious group, because the rumors usually come from either the religion or from the traditional institution. So those two people are now working hand in hand with the government to ensure that these rumors are removed. Then we also have issues of supply side. Immunization, the vaccines are not that, vaccines are not like paracetamol or like water that you can put in the fridge and bring out and drink. You maintain those vaccines at a particular temperature. So that is where you have the cold chain equipment and the rest of them. They are not cheap, they're expensive. So there are a lot of people working on this cold chain to ensure that the potency of the vaccines are secured. And of recent, the MPHCDA is working with the private clinics to ensure that what they give to them is actually kept in that normal potency. I'm sure you recall during COVID vaccine, we need to get a temperature below what we'll be having. And the government have to bring a lot of money to procure those things to actually ensure that the vaccines are potent. So you need those potency to happen. And there are a lot of people supporting immunization in various aspects. There are CSOs who are helping to mobilize at the state, helping to mobilize at the community level to ensure that people come out for vaccination. Then there are people developing different apps to ensure that if a child is supposed to go for immunization and the date reach, a text message goes to the child that, look, you're supposed to come for so time. Those are innovations that are happening by CSOs, by partners and rest to ensure that that actually happens. Then another major issue again is the issue of addressing the people's mindsets of what immunization is about. Because, like I mentioned, hesitancy is related to people not accepting or people believing different things that are not really happening. So those challenges are there. And another one is opportunity. Before now, if a child goes for immunization, they don't do other things, like he mentioned. So if a woman is coming for postnatal at 6 weeks, it is expected that child should come with the woman. As I examine the woman, the child will take the vaccine due that child. So most time when you have opportunities that bring people together, also always get the immunization people to also join. I used to be I used to support medical mission in my association, right? That's medical mission, and we do it every quarterly. And each state we go to, when we're doing immunization, we collaborate with the primary care agency of that state to ensure that during that medical mission, which is free, children are brought and get vaccinated. So those are opportunities which people are doing. CSOs, your friend, Dr. Mahmoud, he has a group that's actually working on some of these things to make sure that things work. So if you look at the landscape, yes, it's good. Everybody is putting all their effort to ensure that these children are given what is due them. And once a child is fully vaccinated, free of diseases, the child will not miss school. Because most times, once the child is sick, he won't go to school. Child doesn't go to school for 2-3 years, he starts failing. 2-3 months, start failing exams, and he won't catch up. So a lot of the problem we're having now could have been prevented if these people you see roaming around or causing problems had access to education because of prevention from having diseases, and they move on. So it's a whole life course, immunization, and it's if we start discussing immunization, you won't leave the studio. So let us just take it that the landscape is good. The number of children reached are improving. It's no longer just 1 year old child anymore. They've increased it to extend to even the girls which are now receiving HPV. Yesterday, the governor's wife had their own meeting, and we're invited to actually talk to them on HPV, which we did. And if you hear their zeal, you will know that yes, this party to do this work if they are properly informed. So that is why it is good to have everybody informed, and that is the purpose of this immunization week. Let people hear about immunization, let them know that this is what we're supposed to do, and everybody be on board. So that with all hands on deck to ensure that these children are protected.
Sorry, in addition to that, he talked about we call SIAs, we say campaigns, not political.
Yes.
Election campaign.
Okay, see, routine immunization should be a normal in the health facility, and they should also do outreach services. When I say outreach services, locations that are less than 2 kilometers within the catchment area of the health facility, caregivers should bring their children for routine immunization. But areas that are above 2 kilometers, they should do outreach services. So one of the challenges that we also have is that the sessions are not conducted optimally. A health worker is supposed to go for outreach session to this community. The health worker does not go. It may be due to funding. It may be due to attitude. So if there is funding for the health worker to go and conduct the outreach and the health worker does not go, what is the accountability framework on ground to sanction that health worker? Human resource is also a big problem. You have one health worker. If you go to some rural areas, you have one health worker in a health post. This particular man is doing ANC, taking delivery, treating diarrhea, giving immunization. So if that particular health worker leaves the health center to go for outreach services, that means that other children, other caregivers are come for other services that are not immunization, will not have any service. Then we also have this campaign thing that we have. See, we are supporting MPSA to work to see how our campaigns will be more effective. We try to reduce verticalization of campaigns. There's no need, if you are doing measles campaign that you are targeting children 9 to 59 months, why can't you target the child and also target the caregiver? If the woman that brought her or him is up to 15 years to 49 years, why don't you give the child measles? Why don't you give the mother tetanus? Okay, must you give the child only measles? Why don't you ask if the child has been documented, has birth certificate? You can also document the child. Can't you treat the woman? Can't you give the child vitamin A? Can't you give the family, the mother and the caregiver bed net? So partners, WHO, UNICEF, and other partners, are also supporting the government to see how we can make our campaigns to be much more effective. Then, as Dr. Terry said, after all these things, there's the issue of trust when it comes to immunization. You know, we are all Nigerians. I'm a Nigerian from Anambra State. There's an impression that every Nigerian has that whatever is provided free of charge, that there is something in it.
It has no value.
Thank you. So it is also a mindset when you are told, come and bring your child to take meningitis and you're not asked to pay for it. There's a kind of we are all Nigerians, maybe including me. I'm not exonerating myself. So there's also this issue of trust and a lot of things. As he said, if we start discussing immunization, we'll just be taking it in bits and in summary, because if we start discussing immunization in this platform, the time will definitely not be enough. So we'll just take it in bits and bits.
So how much is the issue of conflicts and crisis in various parts of the country affecting the immunization process?
It is affecting the immunization process in such a very, very big way. Because in Borno State, some of the places are shut down. In some areas in Kaduna, I'm not supposed to. In places where you have health conflict, the health facilities are not even open. The health facilities are not even open to conduct the normal routine immunization. So if a health facility is not open to conduct normal routine immunization, how can you now have the confidence to tell the health worker to carry vaccines, climb on a bike, pass all those farms, and go to conduct outreach services? You understand? So there are a lot of things. Okay, let me give you an example. Like in Borno State, we started yellow fever campaign. Yellow fever campaign is what we do once, and we just go out of the state. In Borno State, because of the insecurity in Borno State, we pre-position about 500,000 doses of yellow fever vaccine every year to do a campaign in Borno State, because we can't forecast and reserve millions, because we are not sure that we are going to go to the state and cover everywhere. So insecurity has a major role to play in the issues we are having. In some places where you have some places, even during our campaign, some health workers have been kidnapped. Even in some health facilities, health workers have been kidnapped. So I'll try to round up by saying that if there's insecurity and the health worker is not confident enough to come to work and stay in the health facility for 2 hours or 3 hours to deliver routine immunization services to our children, how will you have the confidence to tell the health worker to carry vaccines on a bike and go to the hard-to-reach areas where the insecurity is higher to do outreach services? So it's affecting routine immunization in some places. It's affecting outreach session in the places, reducing our coverage, reducing herd immunity, preposing our children and community to outbreaks for the vaccine-preventable diseases.
Dr. Terry, in addition to this issue of insecurity, crisis, conflicts in these places, there is also the whole issue of, let me put it this way, affordability for government now. We have witnessed some of the hottest season in Nigeria and elsewhere around the world this year, for instance. And you talked earlier on about how these vaccines must be preserved in a certain temperature and all of that. In a country where we are grappling with power issues, which is required to preserve these vaccines in a certain temperature and all of that, in a country where we have infrastructural deficits, roads and all of that to get to these places, how much of that is affecting the whole process of getting universal immunization?
Okay, thank you so much. Yeah, it is true we need those specific temperature for our vaccines to be potent. And I can say that irrespective of the problem which the country has in terms of power, right? I think immunization is one sector that actually held on firm to ensure that those vaccines are potent. So solarization is something that the country has actually undertaken, where most of the health facilities have solars to ensure that the vaccine's potency is maintained. That's a project which is huge. And in all the cold stores, cold rooms, I think the government have actually tried in providing alternate power. So if there's no cold room you go to or cold store you go to, you will not see up to 2-3 generators working. So it's a challenge. It adds to the cost of vaccination because when you spend huge amount to procure diesel to run your cold room, when ordinarily if there was a national grid supply to it, then the cost will actually come down. So it's something that is a big problem, but I will not say it has affected the program drastically because when they go for campaigns, when they go for those campaigns, those things, those women, girls, children carry on they call it vaccine carrier. They all have what you call ice packs. They have ice packs that maintain the temperature. And if you notice, as those people are working, you see other people, supervisors, coming to support them with other ice packs in cold boxes. So they try to make sure those things are not an issue. But it's a big challenge, which government, at least this superior to actually tell government, please, whatever you need to do in actually streaming it up is fine. Good thing, we have, we're not in the position where things are really addressed as it should be addressed because the issue of solarization is something that the government took very, very personal with support from partners, donors. Most of the health facilities in this country are being provided with solars.
That's across the state.
Across the state. Across the state. If you go to my village, I went to the PSC in my village. Each time I go there, I try to look to be sure that the solar is working and the vaccines are in very good state. So it's something that's my village is far, so if I can get that to my village to tell you that it's also occurring in virtually everywhere, and it's fine. But day in, day out, the cold chain equipment, which are already getting old, they replace them. They bought them. Because they all have lifespan. Some 5 years, some 10 years, and cold. So once it is that, the government replaces them. So they've tried in actually helping that issue of maintaining the temperature. During COVID, I'm sure if they tell you the cost of those things they use in carrying COVID vaccine, those minus whatever, it's not, in short, they will sell a whole state now to buy some of those things, but at least they're able to provide to make sure that these people who needed those things are giving what they're supposed to get. Yeah.
Sorry, sir, in addition to that, just what he said, Gavi, Government of Nigeria and UNICEF, let me let you know that over 90% of the wards in the country has at least one SDD, solar direct drive, for preserving of vaccines. And UNICEF has done so well, a lot of procurement of working cold room, a lot of procurement of geostyles, what she said those women normally have. There has been a lot of investment in that, but I'm not saying that we are okay. There's still room to make it better, since, as you said, we are introducing new vaccines and more new vaccines are in the pipeline. But the government has really made great progress in that. If we have about 9,552 wards, over 90% of them have at least one SDD. But it's good to have SDD. Then it's also another point is, and UNICEF has people that go around maintaining them. Just like he said, if we can have more Nigerians like Dr. Terry, if he goes to his village, he goes to the SDD and check if it's working. So
possibly because he's a medical doctor. That's
so
why
if I can do that and you can do that.
If I go to my village, I'm not a health official. I will not avert my mind to a place like that.
I'll be doing that on your behalf, since.
Yeah. Okay. All right. But let me bring you back to the issue of hesitancy. Okay. Is there a situation where we still have that really, really playing a role right now in the immunization drive? Do we still have communities? Do we still have places in states where people are very opposed to immunization for whatever reasons?
Yeah, I think it is still there because it's a global problem. And it's like the anti-vax, they're increasing every day with social media. I'm sure during the COVID, you saw where they will put whatever and price something, light will come and say the vaccine is bringing light. So they are improving in their drive to make sure people don't get vaccine. I don't know whatever reason. Maybe because, like I said, it's free or something, but nothing good comes without having those problems. So that is the way to take it. But the social mobilization group, they've been working and working. There are some churches that during campaign, we go specifically and start calling either the pastor or whoever is a health worker there to explain to them. So there are churches, there are some custom that will tell you we don't take this kind of thing, but as the years have been going on, a lot of work has gone into that and it has actually reduced.
So what strategies is UNICEF, for instance, putting in place, especially during this week, to promote and ensure that the awareness is created to defeat the anti-vaccine?
Anti-vax.
If you check, UNICEF is doing a lot using our social media handle, promoting immunization. And I think 2 days ago, Kate Henshaw, we have some vaccine champions, people respect in the culture. I think she was in Bauchi 2 days ago, going to health facilities, telling mothers on how to, the need for immunization. Yeah. Also, let me also tell you that in campaigns, in preparation for campaigns, UNICEF supports community engagement activities. We have stakeholders meeting. When I talk about stakeholders, assuming we're having measles campaign, we try to engage the Ministry of Education because we're going to go to schools. We are trying to engage the mosque, the churches. We have engagement meeting with them. They express whatever fears they have, and we have experts to address that. We also have the Miangwas or the chiefs or the Igwes. We do a lot of community dialogues. When I say community dialogues, we fund in settlements where you have Miangwa, they bring in key influential people in the settlement on the world. We have engagement meeting with them. They express whatever fears they have, and we make sure that we address them. We also try to bring some experts. This is also part of what we are doing, to explain to people on how, why, and the need for them to take immunization. Immunization is very, very safe. I had my COVID, and I was vaccinated when I was small, and I'm a doctor. Immunization is safe. I understand just what he said, the social media, everybody, once you have a phone, you are connected to the world. Everybody has right to say anything, but I'm telling you the truth that immunization is safe. When you give your child measles, you have high chances of protecting the child from having measles. Look at what meningitis did. Over 200 and something children died in the first quarter of this year. Then we did ICG requests, brought in meningitis vaccines, and went to those key high-risk areas and vaccinated them. But look, if you look at the trend and see what is happening, it is going down. You also mentioned about you said something about diphtheria. Look at the intervention that MPSCD and partners did, and you see the things started going down. So immunization is cost-effective. I know many people are saying a lot of things, but UNICEF is using every platform, social media and community engagement, involvement of CSOs that are close to the community to mobilize the people and assure them that this is safe.
Just as we talk about some of the success stories that have been recorded, there are also situations where you have underserved areas, hard to reach communities, and people, children are born in these places. They live in these places. They are meant to survive in these places. How do you tackle situations like that?
Okay, thank you. So I think one of the reasons for this, I think this year's theme is humanly possible, right, for vaccination. So they want people to do all that is humanly possible to ensure that every person have access to the basic vaccine that is due them. So equity is one of the things that actually comes to play. So in places where they don't have access to some of these life-saving vaccines, people, the teams, they plan to get to that place to ensure that they are giving those vaccines. So that is where insecurity becomes a challenge when they have those kind of places. So that is one way. Then also, if you look at the strategies of immunization, apart from the routine where you have health facility, you plan for outreach, plan for outreach, where you now leave the health facility to go to a school or something, gather them and facilitate them. Those are some of the things people do to actually reach those people that are underserved. Because if you take a survey of people that have been immunized in this country, if you look at the location, the urban areas they do very well than the rural areas because of this issue of them not having access. So the program is so designed that those people are planned for. So you plan to go and do an outreach in the community. And if it happens, those children get what they're supposed to get. But if it doesn't happen, that's when you have issue. And when you do campaigns to actually support your routine, you lay a lot of emphasis on those communities, because if those people don't get the vaccine at all, even your child that has been vaccinated is not safe.
It's not safe.
So for measles now, if you go to a school where a class of 30 and only 5 of those children have been vaccinated, those 5 that have been vaccinated stand a chance of getting an outbreak. So it's something that you don't protect one, and the way diseases are, they don't have boundary. There's no international boundary that says it's happening in Cameroon, it's not going to get here. No, it will cross just as anything happens. So, but one thing we'll look at is that if a community can get Coca-Cola drink, right? The soda drinks, then that community can also get the vaccine. So if you look, there's no village in this country that doesn't get soft drink. So we use those assumptions and those plans to actually ensure that the vaccine moves from where it's supposed to be to those places. So that's why there are a lot of strategies which is actually helping.
These vaccines are not a one-off thing. They are
sequential, yeah.
Yes, and all of that.
So that's why it is a continuous program.
So you must keep going back to those villages,
yes.
to those very remote areas.
And children are being born every day.
Exactly.
So let me give an example, because this is for people to really get enlightened. I know there was a time where supposed to take to go and ask for fund from ministry. That this year, this is the birth cohort. One of the people that worked in finance said, last year people collected money for this vaccination. Has it not finished? So I now said, that means you don't understand the meaning of birth cohort. So every year, newborns are born, 7 million plus every year in Nigeria. And so you have to start catering for them. So that is why it's a program that needs all the support. So we also use the opportunity to also talk to the government, right? Human resource for health, that we mentioned, is a major challenge, which has actually made things to slow down. He told you about the story of one person, one health worker in the post, vaccinating, taking deliveries, treating malaria, treating diarrhea, and the rest of them. That is not supposed to be the case. So government should invest on human resource for health. And at the governors forum, we preach it, and we make this so possible that, because there's what we call task force on PSC and immunization. The deputy governor chairs it. They meet every quarter. Those are things they put in place to ensure that this program does not suffer political commitment. So the deputy governor, they chair it every quarter. Some even do their own every month. And in that meeting, problems they have are actually put together and sent to the deputy governor, and government now handles them based on the capacity which they can do. The one they cannot do, they beg donors. I know the zip line is one people that help to move vaccines to remote places. Those are things that people are putting together to ensure that these vaccines get to the place. Okay, I was in Bayelsa. Bayelsa have a zip line. When you press the drone to take delivery to Nembe from Yanagwa takes at least 4 hours by boat, right? The drone went there 27 minutes and came back. So those are devices people are putting to ensure that this program does not suffer anything. I was talking about your friend, Mahmoud, who developed that vaccine carrier. Those ones are things that can actually keep the vaccine active without having any issue. So it's a very it's a collaborative effort by everybody. Yeah. And that space is is expanding every day.
Mm. Dr. Zebilo, you just harped on an aspect of distribution now. How much is technology aiding in the immunization process globally now? We see a lot of it happening in the global north. We see some African countries beginning to adopt technology to reach far-flung places, hard-to-reach places, underserved places. You just talked of drone now being adopted in a place like Bayelsa. How many more places are beginning to think, or many more state governments are beginning to think in that direction?
Okay, so the part of the benefits of this platform is to also sensitize people. Some states, but we are not yet there. We are not yet there. And that is also what is contributing to the poor routine immunization coverage. It's for the partners that have expertise in those areas to talk with the state government, using the Nigeria Governors Forum to enlighten them more. There are many places in Kaduna, in Borno, that have security issues. I know Borno has gone far. They have choppers. They have a way of doing, there's something they call hit and run with the vigilante and the military. But there's improvement because of insecurity. It has opened the eyes of a lot of people, but I think we are not yet there. So it's also something that the Nigerian people like Dr. Otere can champion among the governors to see how we can scale it up. Because once we scale it up, our coverage will definitely improve. We are not yet.
Yes, you will expect that a country like Nigeria should be in the forefront of this kind of thing, where small countries, smaller African countries are doing it very well.
So I'll also chip in terms of technology. One of the greatest challenges which we have as a country is knowing how many we are. You see some people tell you we are 220-something, we are 210, different figures. But we've used technology to actually estimate the number of people in most of the people using the geospatial system, right? So when we did some of those campaigns in those years, we have to apply the technology of GIS. With GIS, you can plan for a community to ensure that there's a fixed post within a kilometer radius. So the person will not say, because it is so far, we couldn't take a child there. So those are the things that technology has actually done for us. And use of drone, there are a lot of things that technology has actually helped us to do. The vaccine carrier, you can put things that can actually track that the vaccine goes. Because while you were talking of hesitancy, even some of the health workers are also problem to whatever you're doing. In those days, they would just go to the riverside, pour the vaccine away, and mark that they've already vaccinated. So things have been put in place to ensure that if the vaccine is moved from that carrier and poured, you will know. So there are a lot of things technology has actually helped in actually making the system to be very, very effective.
All right, thank you so much, gentlemen. Thank you for your time. Dr. Avua Joseph Oteri is the current advisor on immunization to the Nigerian Governors Forum. Before then, he was a director in the National Primary Healthcare Development Agency. He's a public health consultant. Thank you so much for your time.
Thank you so much.
And Dr. Obiora Ezebilo is a health specialist at UNICEF. UNICEF being the United Nations International Children's Emergency Fund. Thank you so much for enlightening us on immunization and, of course, what Nigerians need to know and what governments should do to enhance our immunization status in Nigeria. Thank you so much, gentlemen.
Thank you very much.
Thank you for investing your time with us, and we look forward to bringing you a fresh edition of the program, People, Politics, and Power. Bye for now.